Good afternoon, everyone. My name is Pyun and I'm a second-year medical student at the University of Maryland School of Medicine. Thank you for allowing me to present my work at ICS 2020. Now I will begin my abstract presentation. I have no affiliations to disclose, and our research was self-funded. Patient decision aids help facilitate shared decision-making in patients when available treatment options present variable benefits, risks, and uncertainties, and they can help patients choose a treatment that best aligns with their personal values. In order to serve their function, decision aids must provide accurate and balanced information, but poorly developed, inaccurate decision aids can lead to patient anxiety, confusion, and conflicts between physicians and patients. Given that around 80% of patients are turning to the internet for health information, and that 1/3 of the US adults have below basic health literacy, there have been concerns about the quality, accuracy, and reliability of online decision aids. There are currently few studies evaluating the quality of urologic patient decision aids and none comprehensively assessing them using 3 different measures. The objective of this study is to assess the online patient decision aids for benign urologic conditions for their readability, quality as consumer health information, and quality as a decision aid. The methods are as follows. Searches were conducted from January 20th to April 29th, 2020, and there were 4 conditions of interest. Searches were performed on PubMed, Embase, and decision aid repositories, and on Google. For the Google searches, only the first 2 pages were used to reflect how most patients access online health information, and incognito mode was used to avoid personalized search results. Sources are included or excluded if they met the following criteria. We then assessed the included decision aids for the following 3 measures. First is the readability score, which gives an objective measure of the complexity of the text. We used 4 different readability tests and used the average to determine the readability score. We then used the DISCERN instrument and the International Patient Decision Aids Standards Minimum Standards Criteria, or IPDASI version 4.0. The DISCERN instrument is a reliable and validated tool that assesses the quality of written consumer health information. IPDASI version 4.0 is more specific to decision aids than the DISCERN instrument, and it sets the standards with its 12-item checklist. This flowchart demonstrates our search process. A total of 470 records were found and 14 decision aids were included. This is a summary of the decision aids that were included. We identified 3 pelvic organ prolapse decision aids, 8 for urinary incontinence, 3 for benign prostatic hyperplasia, and 0 for overactive bladder. The average readability grade level score was 11.08, which indicates that on average, at least 11 years of education is required to comprehend the decision aids found online. This exceeds the NIH recommended readability level by 5 grade levels. Also noteworthy is that 3 of the 14 required a college-level education to understand the material. The DISCERN instrument assesses the quality of health information by checking whether relevant information is present in the document, such as do they list the benefits and risks of each treatment. The overall mean DISCERN score of the 14 decision aids was 57.6 with a standard deviation of 6.7. This falls under the range of good quality, and none of the 14 decision aids received a score ranging in the poor to very poor category. Interestingly though, the majority of the decision aids did a poor job providing the sources of the information as highlighted in red. IPDASI is similar to the DISCERN instrument, but it is more specific to assessing decision aids. None of the decision aids met all 12 of the minimum criteria, and the average score was 8.3 out of 12. The text in red highlights where the majority of the decision aids scored poorly. As indicated, none of the 14 decision aids provided an update policy, suggesting that addressing these issues can easily and quickly improve the quality of the decision aids. In conclusion, online urologic patient decision aids require a significantly higher reading level than recommended by the NIH. While the decision aids received acceptable scores as online health information, none met all 12 minimum standards for decision aids set by IPDAS. Medical professionals should be aware of the quality of the patient decision aids and consider development of better urologic patient decision aids. Thank you for your time.